Sponsored in part by One Brooklyn Health.
You know, most of us have no problem talking about our aches and pains, and if we catch the flu or if we're feeling sick, we head to the doctor. But when it comes to mental health, people can find it difficult to talk about their struggles and seek out the help they need. Our guests today are working to change that. Susan Kleinrock and Jason Hershberger from One Brooklyn Health are here to talk about mental health and the resources available in your community. That was a mouthful. I'm glad you two are here.
Thank you.
So Susan, I want to start with you. What are some of the trends you are seeing in mental health, or I guess our approach to it?
We're seeing an increase in mental health, but particularly in the forms of anxiety and depression and isolation. Since COVID-19, we had to adjust the way we view the world and deal with the world. So people had to go into hiding, and in a sense, their anxiety levels increased. The social isolation caused them to be more lonely, more depressed. They had to deal with themselves. So we saw big trends and increases in need for services.
Right. Jason, when we talk about mental health, what kind of conditions are we really talking about?
Well, Susan mentioned that it's a lot of anxiety and depression, but the other thing is drinking too much or using too many drugs or getting involved into substances. So those are the most common problems we're seeing.
Yeah. A lot of talk about, okay, first of all, you have to admit that anxiety is a thing and it can be debilitating, but it's another thing to take that a step further. So I wonder if you could talk to us about the challenges of having people open up to talk about their mental health.
Well, you know what? May is Mental Health Awareness Month, but you know, frankly, we're all aware of mental health.
Sure.
Everyone I know knows somebody with a condition or loves somebody with a condition, and so we're all aware of it. It's just that we hide it. We don't want to talk about it. You know, New Yorkers are tough, and we don't like to be vulnerable. And this kind of condition is hard for us to reach out for help, to talk to our friends and families, and see a doctor for.
Right.
Go ahead. The stigma of mental health is still pervasive. I think no matter how hard we try and celebrities come out and talk about their struggles with mental health, for communities of color particularly, it's very difficult to acknowledge or to seek treatment and say, I'm anxious or I'm nervous without having some label attached to it.
Sure. And I know we talk about on the show, sort of in light, as New Yorkers, the standard greeting is, you good? You good? And it's almost like that's a blanket statement and almost an admission that I'm good, but I'm not really good. And I know you hit upon communities of color. Why do you suspect that there is an even deeper challenge with communities of color in the way mental health is approached? Because I know, as a Puerto Rican, when I went to therapy, my mother was like, you don't need therapy, just go talk to, you know, a clergyman. So there is that stigma, but I wonder from your vantage point, what you might see.
We certainly see that there are social factors and the hardships of life in our communities which affect people reaching out or having the ability to reach out and ask for services. Partially the stigma, partly the fact that they're coping or juggling with their own issues, real issues, which take time, and our services may not be as accessible as we would like them to be. But at One Brooklyn, we're really working on making services available to the community.
Which leads me to my next question. Jason, what is One Brooklyn Health doing to improve access and outcome when it comes to mental health?
Well, One Brooklyn Health is organized around providing care for the whole person. So their physical health, their mental health, substance problems, all come together, and we have treatments and clinics to handle all of those issues. You know, with the support of the community and the state, we were able to open new state-of-the-art inpatient services, new emergency services, crisis programs that go in the community and will see people in their homes, and many clinics where we can see people, where we have wonderful therapists, wonderful doctors that can help people through rough patches.
An important conversation to be continued for sure. It doesn't end here. Thank you both so much.
Thank you.
Thank you.
Sharing your wisdom, and don't forget to scan the QR code on your screen to learn more about One Brooklyn Health's resources for mental health.